Thank you very much for that. It's really, really fascinating. We do have time for about 5 minutes of questions. I can see hands firing up already. We'll start off over here. There should be a mic coming behind you just now.
Thank you so much for that. I also work in your sort of strange, lonely space, so very much appreciate it. Our research institute is actually doing some data linkage across the life course, so it would be great to talk about at some point. But something that we have heard a little bit about from mental health nurses and respiratory health nurses is that there might be some link related to the ways that we treat respiratory health and the onset of acute mental health symptoms. And I had never come across this before, but I had a nurse talking to me about the overuse of the blue inhaler, I think it is, and the panic that can be caused by the fear of the onset of an asthma attack. And I even sort of spoke to some lived experience experts about it who said that they did have the experience of overusing the inhaler when they were panicking, and that this could further kind of create panic biological response. And I've tried to look in the literature about it, and I've just found very, very little on the links between some of the prescriptions and things like that that we use for respiratory and mental health. So I was just wondering if you have any insights.
Yeah, it's a really important reflection and question. Health psychologists are experts in this space, so they work in the psychology of managing physical health conditions. So general psychologists may or may not be as familiar with it. It's a complicated mechanism again. So on the one hand, if you have asthma, you're terrified of having an attack and you're anxious. And just by having anxiety and the cognition that you might have an attack, or that you tend to have attacks when you walk that way rather than this way, that cognition itself is powerful. There's lots of work in cultural psychiatry showing that particular lay belief systems can trigger incidents. Emotional arousal, for example, can lead to anxiety and panic. Even epilepsy can be triggered by emotions, powerful emotions. So there's lots of treatments using CBT for managing emotional responses for the management of epilepsy. So I would offer the same sort of paradigm there. In terms of the inhalers, it depends what's in them, and if there are stimulants, they can lead to anxiety and panic. I would imagine it's a combination of the two, but that's a perfect example of an observation made in a clinical setting that should be pursued further and explored further. But I'd suggest the health psychology literature is probably better, and it's a slightly different discipline from general psychology.
Thank you.
There's a question over here. I think Ben. Oh, yeah, come to the front first. It's probably easier.
Hello there, my name is Joe Lenario. I have a background in health psychology, so please do find me later and we'll have a chat. I'm aware that I've got Professor Holgate next to me, who published extensively on asthma. I'll say quickly there is an effort to move away from the reliance on the blue inhalers, which is great. Would you be happy to talk a little bit more about this arts project you mentioned? It's really, really important, and I agree with what you were saying.
Right, it's a number of projects. So the work I do now is very interdisciplinary. I've involved artists in the work I do over probably the last 10 years, I think. And they're involved in several projects. One of them's a tune, it's called. It's about adverse childhood experiences. And it's very hard to talk to children about things that are painful or that they can't even remember. So art offers a kind of a gentle, creative opportunity. And creating art in order to transform that pain and then to be able to inspect it and understand it. So that's one of the processes that is helpful, and it's an empowering process to do research that way. It's not easy because art isn't designed for research of that, and so the artists have their own approach, and then there's always this sort of interdisciplinary dispute about are you mistreating the art object? Are you mistreating us as a profession if you're putting it to this purpose, and can the art speak for itself? So there's that kind of conversation that goes on. But also the fact that you have outputs, and we've got a dissemination event in Oxford on Friday, tomorrow in fact, on that project at the Richard Dole building. You can go onto Eventbrite and register or just turn up, I'm sure it'll be okay. So that's one project, but I'm also using it in other projects, using a methodology called photo voice, which is participatory art. And from a systematic review, that's the only participatory process that we found has some data on outcomes and impact on people. And so we use that both on two projects. I can give you a quick example. One is on people who have been detained under the Mental Health Act from ethnically diverse groups, because not only do they have more psychosis,